Hello everyone, hello beautiful listeners, professional colleagues from all over the world. How are you doing today? This is Nurse Goodness again from Republic of Ireland saying hello to you. I hope you guys are doing well and I hope you enjoyed my previous video. In case if you have not watched my video, please go to my YouTube channel, click on any topic that you want to watch and then listen to it. I'm sure you will like it. Anyways, for today, we're going to be comparing working as a professional nurse in Republic of Ireland and in United Kingdom, Ireland versus UK. That is the title of this video. Okay, guys. So let's get started. Okay. So today I'll be discussing 4 basic things. One is the basic for you to start your registration with National Military Board of Ireland versus basic requirement for you to start your registration with NMC UK. That is one. Another thing I'll be addressing on this video is exams. What kind of exams will you have to write for you to come over and work here and or UK? And the third thing I'll be discussing is the salary differences. Do they pay better in UK or in Ireland? And the last thing I'll be discussing is about family unification. Some people are yet to understand that Republic of Ireland is different from United Kingdom. Okay, in UK we have Northern Ireland as part of UK. Northern Ireland is not in Republic of Ireland. Republic of Ireland is different from UK and it's also different from Northern Ireland. So let's get that clear. So to get started in the registration with NMC UK or NMBI, which is National Military Board of Ireland, you have to first get your basic English requirements. I have a different video for that, but I will just say 1 or 2 things about it who have not watched that very video of mine. Okay, so if you choose to write, is it that you choose as an international nurse, is it that you choose to write IELTS or you choose to write OET? Okay, if you choose to write IELTS, if you want to practice as a nurse in UK, your the minimum requirement for that for UK is that you have to have 777 and 16.5. As at the moment now, they might change it tomorrow, but as at the moment, the minimum requirement for you to work in UK as a nurse is 777 and 16.5, and that 16.5 has to be only in writing. Okay, you know that in IELTS we have 4 modules: reading, listening, speaking and writing. So you have to have 7 in reading, 7 in speaking, 7 in listening, and then 6.5 in writing. This is the minimum. You can get up to 8, you can get 9, okay, but the minimum you can get for you to proceed or for you to get registered with NMC UK is 777 and 16.5, and that 16.5 has to be only in writing. Now versus Ireland, that's Republic of Ireland, the minimum requirement for you to get registered as a nurse here is 777 16.5. But the difference between that of UK and Ireland is that UK is fixed, that 6.5 has to be in writing, but Ireland own is flexible. It could be in any of the model. It could be in speaking, could be in writing, it could be in reading, it could be in listening, so whichever one. So it's flexible, but it has to be just 6.5. Okay, so that's settled. That's the basic requirement. Now let's talk about the exams. Okay, if you choose to go to UK after getting your OET or after getting your IELTS, you're expected to write CBT, and this is to be done in your country or any country that you are residing at the moment. Okay, you write your CBT exam, and then when you pass, you can now travel to United Kingdom to write your OSCE. So you write your English test exam, you write your CBT, and then you travel to UK and do your OSCE rather. Okay, you travel to UK and do your OSCE. But if it's in Republic of Ireland, you get your English requirements, either OET or IELTS, and then you travel to Ireland. You're not writing any other exam, okay? You travel to Ireland and then write your aptitude test first and do your OSCE, and then you get registered as an Irish nurse. Okay, so that is it with regards to exam and the basic requirements. So we are done. The next thing we'll be talking about is salary, and I know that many people are interested in hearing this because I do receive lots of questions like, goodness, I've gotten my IELTS, I've passed my IELTS, I've passed my OET, but I'm just so scared. I don't know, should I proceed to UK or should I go to Ireland? What's your advice? The choice is entirely yours, but it's my duty to avail you some of the basic information that you need to know before you make your choice. Yeah. Okay, guys. So for salary scale, go travel to UK. You are permitted to work as a support worker. Okay. Yeah. Before you go in for your OSCE. You can work as a support worker in UK before you go in for your OSCE. And most trusts might likely start you with band 3. Okay, and for band 3, plus or minus, you might be paid around 19 to 20 or 21, 22 per annum. Yeah. So, but in Republic of Ireland, you are not permitted to work except you have your PIN. Except if you choose to come and do your adaptation, then you can work as a pre-registered nurse. Do you get it? One thing I want you to bear in mind is that, well, there are lots of differences, okay? But before you make up your mind on which of the country you want to go, you should put some things into consideration. And one of it is that UK uses, their currency in UK is pounds and is bigger than euro because we use euros in Ireland and pounds in UK. So in UK they use pounds, and in Ireland, in Republic of Ireland, we use euros. That is one thing you should consider. So pounds is way bigger than euros. So that is it. And another thing you should also put it into consideration is that Republic of Ireland will pay you based on your years of experience, but UK might not pay you for your years of experience. What do I mean by that? Now, if you've been working in Zimbabwe, if you have been working in Zimbabwe, if you have been working in India, Philippines, Nigeria, Ghana, or any country you are coming from as an international nurse, and let's say, for example, you have worked for 10 years in your country before coming over to Republic of Ireland. That 10 years that you worked as a nurse in your country, in Philippines, in Nigeria, Ghana, anywhere you're coming from, that 10 years will be put into consideration in Republic of Ireland. What does that mean? Now, if you have worked 10 years there, whichever country you are coming from, you are going to be paid same salary with someone who has been working in Republic of Ireland for 10 years. Do you get it? Someone who has been working here 1, 2, 3, 4, 5, 10 years. When you come over here, having worked 10 years in your country, you are going to be receiving the same salary with someone who has stayed 10 years in the profession in Republic of Ireland. So that's one benefit. So I'm just giving you out some of this information so that you can make your choice, okay? It's up to you to make your choice on which country you wish to go. But you need to know some of these things so that you can make up your mind and say, yes, I want to go to Republic of Ireland, or yes, I want to go to United Kingdom. So that is it. But in Ireland, you cannot start work as a pre-registered nurse except if you choose to come to do adaptation. If you are working here in Ireland as pre-registered nurse, it simply means that you are doing adaptation program. So for UK, as I said, they will place you on band 3. Some trusts might give you 4, but most often they place you on band 3 until you write your OSCE. And your band 3 is around, some offer 19, 20, 21, 22, okay? It depends on your employer and the trust you are going to work with. Okay, but for Ireland here, as a pre-registered nurse, you'll be paid around, this figure that I'm giving is not the figures I'm giving, it might not be 100% accurate, okay? So it's just to give you a little tips on what it looks like over here. It might not be 100% accurate. Please don't quote me anywhere. Okay, so for you to work here as a pre-registered nurse, you might be paid around 26, yeah, around 26,000, yeah, in a year. Of course, the adaptation will definitely be around 6 weeks or maybe 8 weeks or 10 weeks, depending on what your employer. Okay, now for those who have gotten their PIN, once you get your PIN in United Kingdom, you'll be placed on band 5. Okay, yeah, whereas in Republic of Ireland, once you get your pin, the scale of your salary will depend on your years of experience. And that's why so employers will make sure that before they give you a contract, okay, on how much, the exact amount they will pay you in Republic of Ireland, you have to get what is called verification of service. Okay, verification of service is simply, it simply means that employer will send, depending on your employer here in Republic of Ireland, they will send a verification form to all the hospitals you claim to have worked with before wanting to come over to work with them in Ireland. If you have worked with 3 hospitals, if you have worked with, let's say, 4 hospitals before coming over, and you have 10 years of experience, let's say 2 years here, 3 years here, 4, 5, and you have 10 years of experience in total. So your employer that is bringing you over here, that you're going to work with in Republic of Ireland, will send verification of service form to those 4 employers you have worked with in your country, in Zimbabwe, Nigeria, wherever you have worked, India, or Philippines, wherever you have worked. They will send verification of service to them. They have to write your start date. When did you started working with that employer? At what date did you start work there? And when did you finish working with them? They will add it together with those 4 employers, okay? And that will give a total number of your years of experience in that country or any country that you have worked. That is your employment history, and that is the verification of service. So the employer has to stamp, has to write those things, write maybe some of your professional responsibilities while you were working there, and then they just have to attest that they know you and that you are a professional, that you worked as a professional nurse. If your employer in Ireland gets all this information, they will use it to place you on a point, okay? Now, I just want to use the example so that you can now make your decision. Like someone that has 10 to 12 years of experience in their home country coming over here to work will likely be placed on salary point 12. Okay, yeah, and that's about, let's say, 46 or 45, 40. Yeah, it depends on your years of experience. Okay. Okay, so a salary is not something that I will tell you the exact amount, okay? Because it's not meant to be made public. It's not salary is not meant to be made public, okay, in social media like this. But I'll just give you a range, and I'll give you the scale, the band that you might be placed on based on the choice, your choice of country. Around here, some private hospitals pay higher than NHS, okay? Yeah, so it depends on the trust you are going in for. But remember, we are talking about euros here, but for UK we are talking about pounds. Okay, so the choice is up to you. Okay, then as soon as you get in Republic of Ireland, as soon as you get your PIN as a registered nurse, and then you're able to submit your verification of service. Let me also remind you that verification of service depends on your employer. There are some employers that will send you the form and ask you to submit it to those places you claim to have worked so that they can fill it in and stamp it for you while you send it back to your employer for a calculation of your salary. Whereas some employers will want you to provide an authentic or an official email of your employer. Sometimes they don't accept Gmail or Yahoo Mail. Okay, it has to be an official email of your employer, and then they will be the one to send the verification of service directly to your employer, and your employer will have to fill it, stamp it according to their requirements, and then send it back to them without it going through you. Some other employer will want you to be the one to do it. So they just want to be sure that that number of years you claim to have worked in your country, that they want to verify if it's true, and if it is true, they will place you on that salary point. Okay, so I can't give you exact figure because different hospitals with their different salary scale, although they are similar here. So it's totally up to you to ensure you submit your verification of service to your employer for them to place you right on your salary scale. Okay, guys, lastly, let's talk about family unification. Okay, I also feel that you need to be aware of this before you make your choice. For those of you that are married with kids, with husband that want to come and practice as a nurse here. Okay, so if you choose to come over to Ireland or UK, for UK, you can actually travel from your country to UK, okay, if you have the finance. Once you have your COS, and of course your COS should cover that of your family to come over. So if you have the finance, like to provide accommodation for your family over there in UK, you can actually travel with your family immediately, okay? What do I mean by that? Your employer will only, majority of the employer in UK will only provide accommodation for you and not for you and your family. So if you choose to come over with your family, it's now up to you to be sure that you have the finance to sponsor that, both their flight tickets, the accommodation where they are going to stay, for you to start your work, okay, as a nurse in UK. If you choose to bring them within the space of 2-3 months of going to UK, you can, okay? But in Republic of Ireland, to the best of my knowledge, as an international nurse, you cannot come immediately with your family. No, you will not be you cannot come to Republic of Ireland immediately with your family, okay? You will first have to come over and do your adaptation or write the exam, because at that point you are not yet sure of staying in Republic of Ireland. You still have to pass the exam for you to get your PIN. Of course, it's the same thing with UK, but in UK, in OSCE, you have 3 attempts, okay? They have the grace to do your OSCE 3 times. Like, you do the first one fail, you can do it the second time and then the third time. But in Republic of Ireland, you just have only 2 grace, 2 attempts to pass your OSCE and get your PIN. So I have a different video on that. You can check for it and watch it. Okay. So for Republic of Ireland here, you can't come with your family immediately. You have to come over first, write your RCSI exam or do your adaptation, get your PIN first, okay? Now, when you get your PIN, your employer is going to apply for your critical skill permit. As a nurse, you are entitled to critical skill permit, okay? Now, your employer is going to do that. Usually in Republic of Ireland here, critical skill takes around maximum of 16 weeks. It could come earlier, it could also take longer, okay? As soon as you get your critical skill permit, you are now entitled to bring your family over. So you see, when you come to Ireland, you won't write the exam immediately, okay? You might come and want to stay 1 or 2 days or even for a few weeks before you go in for the exam, okay? Which I usually advise people to do, to come over, stay some days, meet those that have written the exam so that they can guide you, okay? And also make sure you work with what is written in their site, www.rcsi.com, okay? You get the necessary information there, you get the material, and you also have the opportunity to view some of the equipment you'll be meeting on that day, okay? You view them there before the exam. You also get to meet people that have the equipment so that you can physically touch and feel it before the exam and practice with it, okay? So you have to write the exam pass, and then before you can now. So you coming over, you stay like a week before your exam or 2 weeks before your exam, according to your arrangement between you and your agency or your employer, and then you write the exam. The exam comes out, usually it's written weekend, and then the result comes out on Monday or Tuesday, okay, as the case may be. And if you have to write again, go in for second attempt within 2 weeks of the first result, okay, though you can still choose to change the date if you are not comfortable with that. Okay, now when you are done with that, and get registered, you pay for your PIN, your registration for your PIN, and it takes about maybe a week for it to come out, and then you get your PIN. Now, for as I said, critical skill permits will take around 2 months, 3 months. So when you get that, you have to provide accommodation for your family. You have to have evidence or a proof of accommodation. Is one of the requirements for family unification visa. So you have to have a proof that you have a place where you will keep your family when they come here, okay? And one of their requirements also in their visa application is that you have to also submit your bank statement. Okay, some embassies will request for 3 months pay slip and maybe 6 months bank statement. So apparently you are expected to work at least for 6 months, but it depends on some embassies. Some embassies you can actually bring them as soon as you get your critical skill permit. So it's up to you to go to the website of the embassy in your country and read their requirements of family unification. But for coming there immediately with your family before your exam, it's not done. Okay, I've not seen it done. Okay, you have to first come as a person and then get the necessary requirements before you can invite your family over. There are some, okay, for some countries, when you apply for family unification visa, it takes like 2 weeks for them to approve it for the or deny it. Okay, then your family will then come over. Whereas some countries, you might have to wait for up to 3 to 6 months. Okay, officer to decide on the visa whether they're going to issue or not. Before you apply for your family, make sure you read the website, check out for the requirements, make sure you ask some colleagues that have applied and those that have already got, those that were also denied, ask them questions to know reasons why theirs were denied so that you don't make such mistake. And those that have gotten, ask them to know the requirements, what did they submit to their embassy. Okay, and that will help you not to make mistakes. So that is it for family unification. In a nutshell, you can travel with your family to UK immediately if you have the finance, the resources to do so. And for Ireland, you cannot travel with your family immediately. You have to come over and get the necessary requirements before you can apply. And for UK application, usually take 10 days. Whereas in Ireland here, some people from India, Zimbabwe, yeah, some friends from Zimbabwe said their own took 2 weeks. Some other people from Ghana would say it took about 3 months. It took about 6 months or even more. Some from Nigeria will tell you that it took about 7-8 months for them to get response from the visa from the embassy. So please, my advice to everyone that wants to apply for their family is to make sure you submit all the necessary requirements and also read their site. Please, the best information you can get for any application is from their site. Every other one you get from YouTube, you get from friends and professional colleagues. Those ones are secondary. Make sure you go to the site of the embassy that you're applying for and read their specification, read the requirements, and I'm sure that if things are well done, you will definitely get the visa for your family to join you. So guys, on that note, that is it for this video. I was able to address the basic requirements for you to work in United Kingdom as a nurse and the basic requirements for you to work as a nurse in Republic of Ireland, which I told you that you have to get your IELTS 777 16.5. For Ireland, the 16.5 can be flexible in any of the 4 models, but for UK, the 16.5 has to be in writing only. Okay, and I equally told you that the exams you'll be writing for UK, you write your English test in your back home in your country, and then you do your CBT also in your home country, and then you travel to UK to do your OSCE for you to get your PIN. And then when you get to your when you get to UK, you can start practicing as a support worker. Okay, meaning that you won't be practicing as a nurse. Okay, at that point, and then they teach you, they prepare you for the exam. You go in for your OSCE, and then when you pass, you'll be lifted from band 3 to band 5 depending on your trust. Whereas in Ireland here, you have to write your English test first in your home country, and then you come over to Republic of Ireland and write your aptitude test. Okay, I have a different video for that. You write your aptitude test, and then you do your OSCE, which you're expected to pass the 14 stations in 2 sittings, whereas that of UK is 3 sittings. Okay, so in 2 sittings for that of Ireland, when you pass it, you get your PIN. And then I also told you with regards to salary that you'll be paid based on your years of experience in Republic of Ireland, meaning that if you have worked 5 years in your country, if you come to Ireland, you're going to receive the same pay with someone who has worked 5 years in Republic of Ireland. Whereas in UK, if you choose to go to UK, you'll be placed on band 5. after getting your pin, and from there you progress, okay, professionally. Okay, so that is it for salary, and I also gave you a rough figure which is not 100% accurate. Okay, and lastly, we discussed about family unification. I said in UK you can go with your family if you have the finance, because your COS will cover your family. Okay, but in Ireland you cannot come over from your country to Ireland with your family immediately. You have to first come over and do your adaptation, or write your RSSI exam, pass it, get your PIN, apply for critical skill permit, which should be applied by your employer, and then get the critical skill permit, which permits you to work here. And then some embassies will also require that you submit your pay slip for 3 months, and maybe 6 months bank statement according to the specification in the embassy of your country. Okay, so that is it. I hope this video is useful, is helpful to you guys. All right guys, so that is it, and I'm sure that is going to help you to make your choice as to whether you're going to come to UK or you're going to come to Republic of Ireland. Okay, so I'm going to see you guys in my next video. Please do well to subscribe, share my video, share it to professional colleagues, share it to people that need it, help them to make an informed decision. Okay, so I'll be coming up with different topics, okay, that will help you guys in your decision making with regards to practicing as a nurse in Republic of Ireland and some other countries. I'll also be guiding you guys on step by step on what you're expected to do for you to get registered in Republic of Ireland. Thank you so much for your time. Thank you for watching my video. So please do not forget to click on the subscribe button. You search for Nurse Goodness, click on the subscribe button, like my video, share my video. That is the greatest encouragement you give to me so that I will do more. See you guys in my next video. Bye for now.